Hey, everybody, welcome to the You're Not Broken podcast. What if your low libido isn't a problem, but rather a message? What if healing trauma doesn't mean reliving it, but finally releasing it? And what if sex in midlife could be better, not over? And what about if therapy wasn't about fixing you, but about finding you? So today I have an amazing sex therapist who is an expert in the not so small niche of perimenopause and menopause, Dr. Rachel Boyle. Thank you for coming. Dude, for the people who are seeing this and not just listening on the podcast, I have to describe, we just pulled up to interview and we're both wearing striped collared shirts and it's hilarious.
Yeah, we did it.
Welcome. I said you're a doctor. Am I wrong? I don't know. Correct me.
Well,
What have you done? Why can I not, what should I call you?
Okay, so you just call me Rachel. So I have a master's degree in marriage and family therapy. So that doesn't equal a PhD. What I have done since then is I'm trained and certified in EMDR, polyvagal theory, parts of memory theory. Those are all trauma therapies, and then specialize in perimenopause and menopause. It's amazing. It has over a 90% success
Like this
rate. It's so
random
great.
urologist over here. I'm like, dude, it's fascinating. And I was a neuroscience undergrad, so they would let me in, right?
I think so. I mean, why not?
So EMDR, for the people who don't know, it has to do with rapid eye movements and basically reconnecting the brain back to a more regulated state.
Right. It's called eye movement desensitization and reprocessing. So what it does is it brings up the memory, the painful memory, and then you process it. So it's based on REM sleep. So what happens when you go to sleep and you're in REM sleep is when the brain cleans itself out, right? It works through all the stressful things that have happened during the day, right? Or the past couple days. And so EMDR mimics that process. And so it takes the looping memories. So what happens when people have trauma is they have memories that circle, they loop, right? They keep going round and round. And it takes those memories, it reprocesses them, and it essentially puts it away in the proper file drawer so that you don't necessarily forget the memory, but the intensity of the negative emotion
It doesn't
gets
trigger and shut
desensitized.
you down or push
No.
you into freeze or whatever it
Right.
usually does.
Yeah. Yeah.
So how did you get here?
Oh my gosh. Okay, so this probably started
Here's Rachel's story, my friend.
right. Okay, so it started probably 3 or 4 years ago. I'm perimenopause, right? I'm still in perimenopause because it lasts a really long time. And so I couldn't find any
I've
providers.
heard.
I think I'm on the 15 years
You've got
stretch,
the economy plan. It's
right?
just gonna
Yeah, no,
go
I
for
really
it's
I
like
I
the
got the
big box of Kleenex at Costco.
2 for 1. But so I actually think I started whenever I was in my late 30s. So I had my son when I was 35. I breastfed for a year. After that, I was, 37. I was having night sweats. I was having joint aches and pains. And I thought it was just, busy mom, new stuff. I just ignored it. And then I started getting blood tests. What's wrong with me? No one could find anything wrong with me. Fast forward another couple years, right? And I started the joint aches and pains got really bad. And so I thought I had MS. So I was getting MRIs done at the Mayo Clinic. Of course, no one could find anything. So I had a girlfriend of mine who's 18 years older than me. And she's like, Rachel, I think you might be in perimenopause. And I'm like, okay, I've gone to how many doctors and specialists? It's my girlfriend that's telling me I might be in perimenopause. Right. So then I actually found your podcast, and I just started binge watching. I just was voracious about this stuff. And so I couldn't find a doctor that was trained in Las Vegas. So no doctors trained. So then I found
And
out
how
about
many people
Ishwich.
live in Vegas?
Oh my God, it's huge
It's
and more
huge,
people
right?
by the
Does
day.
everybody is just everybody under the age of 30 in Vegas?
Yeah, it's
I mean,
everybody.
that's the stereotype, right? Are
But and
there
they
any
come and
adults in
go.
Vegas?
Well, there are adults, and some of them don't act like adults.
Fair enough.
They have adult bodies, if that makes sense. Yeah, so then I went to Ishwish and I was like, well, I want to learn about this.
And what was your career at the first time you went to Ishwish? What were you
Where
doing?
was I
Yeah,
was a therapist. I was
you
doing
were
a
a
lot of trauma
therapist already.
therapy.
Okay.
Yeah, I was a therapist doing trauma therapy. And I got to Ishwish. It was in Phoenix,
Did you go to
short
the
drive from
fall
Vegas.
course? I need
I did the
details.
fall
You
course.
did the fall course. Okay.
I did the fall course. And I just was amazed. There were probably several hundred people in the room, most of them doctors, nurse practitioners wanting to learn about women's sexual health. And it was just so eye-opening to me because I didn't know the majority. I didn't know 95% of what they were saying. And here I was, a really educated woman who had done a lot of studying.
Did you just think that we didn't know about women?
Yes.
Yeah.
When I
That's what
got
that's
there,
what I
I
thought too. I'm
realized
like, "No, nobody knows." And then I'm like, "Oh, actually a lot of people know. It just
yeah,
doesn't get out."
it just doesn't get out, and then I just remember this slide, and it had someone dressed up as a vulva, and it said, "Who's responsible for the clitoris?" And I was like, "Who is? Who is responsible for that?"
That sounds like a Dr. Rachel Rubin
Yeah, she was
PowerPoint.
there.
Yeah,
She was there,
so
and
good.
so then I got, like, my big girl panties on, and I, like, raised my hand, and I said, "You know, I need to know if there's any providers in the state of Nevada, because this is where I'm at now." There were no providers in the state of Nevada, not one single provider trained by ISWISH in the state of Nevada. So, yeah, now there's 2. There's me, though I can't prescribe, I'm a therapist. There's me and there's another nurse practitioner, and so I found her about, I don't know, 6 months and 9 months after ISWISH. And so we started working together doing talks with women, just trying to get
We need a
people.
Casperson clinic in Vegas, yeah? So, at that point, you're a sex therapist, you're seeing individuals and couples, you start learning about sex and perimenopause. At what point does your, like, practice change? Or, like, how do you start integrating that?
Well, so yeah, so then I started screening all of my clients, right? Because so what happens, this is what happens to therapists is they have women that show up in their office who have anxiety and depression, or they're having issues in the relationship and they do not know that they're in perimenopause. The therapist does not know that they're in perimenopause. The psychiatrist who's prescribing their anxiety, depression meds, or the nurse practitioner, they do not know. No one knows that these women are in perimenopause. So I started screening all my clients. I printed off one of those checklists, right? And I just started screening them, and nobody knew what perimenopause was. And so I just started working with my current clients. Then I changed up my website, started talking about perimenopause and what it was. So now most of my phone calls are for perimenopause or for like sex trauma, women and men who've had sex trauma in the past or for couples. Yeah.
In your experience, because I mean, the data is crappy. Maybe you've seen this in your field. The incidence of divorce in midlife caused by perimenopause and menopause. Not to blame the
Yeah.
woman, just to
Right.
say
No.
shit gets rocky.
Yeah. Yeah. It gets rocky, right? So it gets rocky for a couple reasons, right? So perimenopause, you have the wildly fluctuating hormones, and which creates a lot of this uncomfortableness, this, anger. Women can get angry, they can get frustrated, they can be sad, and then you have all the physical side effects, and then the GSM, right? So the genital urinary syndrome of menopause, the low libido, the irritation or pain during sex. So you have all of that. But then also, what you have in addition to that is for a lot of women, they're bearing the brunt of the emotional and mental labor in the relationship. Not all of them, right? There's some really great men out of there. But on average, in heterosexual relationships, women do bear the brunt of that. So it all comes to this like crescendo, this perfect storm. And so now she's just crashing, right? And so for some women, it is, get your hormones fixed, go see, Dr. Kelly Casperson, go see someone trained, right? Specifically trained. And I talk a lot about this. You have to find someone who's trained at least by ISWISH, because otherwise you're not going to get accurate information. But, for the majority of them, right, it's like, okay, now how do we start creating an equitable relationship? How do we start talking about sex? How do we start talking about how, as a woman, I want to have sex? Right? So, because we're all trained to have sex, what we call from the male gaze. Well, not all of us, but most of us, because our culture is like that. So, sex from the male gaze isn't necessarily pleasurable, right? For the woman, especially as you enter into perimenopause and things might be a little more sensitive, you got to change things up because sex from the male gaze is what, this is destination sex. Yeah. And you wrote a whole book on that.
So how do you start that?
How do I start the conversation?
Yeah.
Well, it depends if it's an individual or a couple, right? It usually takes a couple sessions, for the client to start to feel comfortable. I usually dive in by the second or the third session because it's like they're coming to see me because they want to talk about this. And so I just start diving in with the questions. And I start out with my first question is when is the last time you had sex? And how was it? How did it feel for you? And I see what they say.
So basic and so like massively important. Like, that even just I wonder how many people actually reflect on their sex life. Good, bad, or neutral, right? Like, I don't know
Yeah.
if many people do that.
Well, I think we get into like a habit with sex, meaning that when you're in a long-term
Like, this is the way
relationship.
we always clean the kitchen?
Yeah, kinda
Okay.
like that. Not everybody, right? But a lot of couples who've been in long-term relationships do that, and it's kinda like you can go, "Okay, you can do it in your head. Okay, this is what we do, and then we do this next, and then we do that next,"
Oh,
right?
yeah, like rote memorization. You could do it in
Yeah,
your sleep, and then women are
you
like,
do it
"I
in
don't desire sex." You're like, "Yeah, because you could do it in your sleep."
right. So, you've heard of Esther Perel? She wrote I'm just reading her latest book, The State of Affairs, but anyway, she was on what? The Diary of a CEO. Anyway, she said, "It's not" she said, "Not that women are not interested in sex. They're just not interested in sex with you. They wanna
Yeah,
have interesting sex."
yeah. It's
So
pretty
women will
mind-blowing,
just
right?
yeah, they'll just stop having it.
What when you say that to a woman, be like, "No, no, no, I'm pretty convinced that you could be sexual, just not with the situation you're doing." Do
Yeah.
their heads explode? Like, how do
Yeah,
they
they don't
handle that
know.
information? Yeah, because they don't know. It's like asking somebody, like, "What do you like in bed?" And you're like, "I've had Fruit Loops for breakfast for 27 years." I don't know.
They don't even know that they can think about sex from a different way. So I'll say, this is what I say. I'll say, if you could create the sex any way that you want it from start to finish, what it feels like, how you want to be touched, how you want to be kissed, right? How you want to be held. It doesn't have to be penetration, right? We're trained to believe that penetrative sex is the way to have sex in the United States and heterosexual relationships. And they don't know what to say back. They're like, "I don't know, I've never even thought if I were to orchestrate it," because our culture really trains men to be the dominant ones in sex, right? They're the ones who orchestrates it, so a lot of women just go along with what's happening.
Okay, so you give them
So how
some
would you
home
like it to be?
right? You give them some homework,
Yeah,
and then they come back. What sort of
yeah.
insights are they having?
It's really interesting. So some of them are like, "I never thought about this before," and they start to get excited. Other people will hit a block. It's like their body shuts down, so they're having what I call a nervous system response. So this is from their autonomic nervous system. So your autonomic nervous system controls your survival responses, right? And also rest and digest. So it's everything automatic. So it's your blinking, it's your heart rate, it's your breath rate, your digestion. Um, and all that's controlled by the vagus nerve. So anyway, whenever there's a body response, like a body shutdown or a body pull away, and women who have done this will know what it is. It's like when you think about having sex and you just kind of you just pull away, you just close down on the inside. That's because there's something going on, whether it's a belief system, whether it's something painful that's happened in the past, or they've told they have to look a certain way, or maybe it's a body image thing, or that they've never really experienced true pleasure before. Some women haven't ever had an orgasm. So their whole system just shuts down.
Then what do you do?
Well, so then I think those cases are actually really interesting, fascinating. So it's like I'm a little detective and I tell them that, okay, like, okay, we're going to be detectives together. And then it becomes, we start to look at what's shutting down. So I'm looking at, are they going into fight, flight, freeze, or fawn? Right. Those are the survival responses. And for those of people who don't know what fawn is a people pleasing response. I'm going to take care of you. I'm going to make sure you're okay so that I can stay emotionally safe. Right, I need you yeah,
I mean, to me, I'm like, I would think like a woman's like, if I go down this, well, I don't know if it's the red pill or the blue pill, like whatever pill
right,
it is, right? If I go down this and
yeah,
I discover something,
yeah.
this relationship might not be the same anymore.
It might not, right? And that's a big don't know. So, in therapy, we don't know how it's gonna go, right? So sometimes women go down the road and their relationship transforms. It gets great. They're happy, their partner's happy, they're exploring things together, they're communicating like Disneyland for adults, right? They're just on the rides.
This is like, that's like when everybody's like, just do sex therapy. It'll be amazing. Like, those
Yeah,
are the people that they're holding up. They're like, when it goes well, it's frickin'
great.
unicorns and rainbows.
Yes.
Okay.
And sometimes it's not, right? And then we got to look at what's going on. Is there a mismatch in desire? You know, does someone want to have sex a lot more than another person? And start to find out what it is and if it's an issue that can be resolved. Right. So I think maybe people are scared, like, what happens if I do this and it can't be resolved? Right. Well, then you can look at that and see what you want to do and how you want to go about it. And can it be good enough? Right. Can it be good enough for the relationship?
Yep. Good enough sex. Who was that? Barry. Barry. That was a sex therapist. Do I have it over here? good enough sex was his thing. Of like, it doesn't have to be good all the time. And then other people will be like, yeah, but it should be good plenty of times. It shouldn't just
A
be
lot
good
of the
enough
time.
all the time.
You don't want to have bad sex.
You don't have bad
I mean, you
sex.
don't want that,
No.
right? Yeah. But
Sometimes
good
you just,
enough.
yeah, sometimes you just need to connect.
Sure.
Yeah.
Yeah.
Well, you make it sound so simple. So why
Well,
are people getting divorced? Because they're not coming to Rachel Boyle.
no, okay. So, God, what was the statistic? Okay. So, women are initiating 70% of the divorces.
Yeah. And if it's an
And
educated woman,
if it's an educated woman,
I got that stat from you. I'm like repeating your stat back to you. And I'm like, yeah, and
if it's an educated woman, it's 90%.
that's
90.
nuts. I gave a talk.
90%.
I gave a talk in
Yeah.
Seattle to it was a business event, women in work, and I gave them that stat, and I think I made some heads explode.
Well, there are a lot of wonderful men who want to be full partners, right? And there are men who don't. And so what happens is when women reach perimenopause, they're either raised the kids or they're raising them, right? They've run the whole house like a freaking CEO, because that's what it is when you run a house and a family, you're the CEO. Maybe they have a partner who helps occasionally, but now you're delegating. That means you're managing, right? That means you're still doing all of the mental and emotional load. And so they just kind of get to the point where they're just done, right? So their partner's got to make some pretty drastic changes pretty quickly. And that can happen, right? Kind of like get with the program. And they can do that. But if you're with someone who doesn't want to do that, if you're really with someone who doesn't want to contribute equally to the relationship and what you want is an equitable relationship, then that's going to be a difficult relationship to stay in and be happy.
The power of midlife.
Power of midlife.
It's a very interesting. Again, I never want to blame the woman, but I'm like, there's something very. I think the attitude around perimenopause and menopause in midlife in general, whatever the ovaries are doing, really needs to change. As far as like, this is an exceptional opportunity.
Absolutely.
Exceptional opportunity.
Yes.
And people need to change their mindset from like, isn't it rough and blah blah blah. Like, yeah, I mean, the caterpillar doesn't complain about going into the chrysalis. They come out the freaking butterfly, right? It's like it is what it is. This is part of life, right? Like, birth is messy. We can't
Yeah.
make it not messy, right? Like,
No.
midlife is messy. We can't make
Yeah.
it not messy. But what we need to do is we need to normalize that it happens, and it happens to everybody, just like
Right.
birth,
Yeah.
and puberty. And
Absolutely.
I think our attitude around it is everything.
Well, yeah, and there's so much around women's sexual health that is minimized, right? So we're not trained on it, right? People are, you hide your period, right? Because that's going to be embarrassing if people know that you're having a period and God forbid you have a leak, right? That's like every, high school girls or middle school
It's like
girls nightmare.
every teen film's pain
Right.
point.
And it's like, but this is a normal part. Like, this is our culture. Our culture has that there are things that women's bodies do that are shameful and embarrassing. So, on some level, we take that in. Even if we don't want to take it in, there's still a part of us that takes it in. And that is what carries over into perimenopause.
Do you
And
think
so
that
much,
explains part of the not resilience, reticence of women to not take hormones? Is they don't want to admit what's actually happening?
well, and it could be that, and that they just don't know what's happening or they're scared, right? So, they're scared to take the hormones because of the WHI. And everyone's told them they're going to get breast cancer, right? Or a blood clot. So they're all either they don't know what's happening to their bodies or they're scared, I think. But I think when they get educated, then they're like,
Then, well, they make very good decisions once they have
making good
education.
decisions.
What have you seen some like amazing transformations in seeing some of your patients get on hormones?
Yes. Yes, I have. And so I see a lot of really good results with anxiety and depression. Right. So women who've never had anxiety can get into perimenopause and have anxiety. If they've had anxiety before, they get into perimenopause and they can have full-blown panic attacks, even if they've never had them. It's really quite terrifying, especially if they're having things like heart palpitations from the perimenopause. That can be really scary. Or, hot flashes and anxiety can go hand in hand. And the depression piece too, same. If you've never had depression, you can get it. If you've had depression before, you can get suicidal thoughts. All that's really terrifying, and women don't understand that it's hormone related.
Yeah.
And I can remember being in perimenopause, right? Sitting at home on my couch, and I'm talking to Charlie, I'm with my partner, and I'm like, holy shit, I'm having an anxiety. Something's going on. I'm having anxiety. Like, here I am, a therapist. I know all about this polyvagal theory. And I'm like, wow, this is just wildly uncomfortable. And then, when all that went away is whenever I started on the testosterone, the anxiety just was
Yeah.
gone.
Yeah. I mean,
It's pretty
testosterone's
amazing.
insane for its neurocognitive benefits and, I mean, aches and pains.
Well, yeah.
Like, people's bodies just don't hurt anymore.
Right. Yeah. Yeah, right. Mine, like, so I was having all those aches and pains and they're pretty much gone. Like every now and then I mean, but nothing's
It's
perfect. So, you are getting older.
I mean, we are getting older,
We are getting
but
older.
I mean, like,
Right. But it
let's
is
let's not
so,
forget, but
let's not forget that. But it's not like I'm waking up every morning with my feet hurting. That
right.
doesn't happen anymore.
Unbelievable.
Yeah.
Do you think the poor sleep, even if you're not having hot flashes, just poor sleep in general is like 80% of women, 60 to 80% of women
Bad.
is very bad. What happens? Is there data on this? What happens when you're not doing deep sleep or REM sleep to those memories and the trauma
Yeah.
consolidation and filing everything away appropriately? Do we know what happens to trauma?
Yeah.
Does it
It's
get
worse.
worse?
So,
It gets worse?
yeah, sleep deprivation, or like if you have insomnia and mental illness, they go hand in hand like this. So if I've got someone who's not sleeping, it's going to be really hard to work through whatever they're going through. And that's what, with PTSD, right? People have nightmares, they don't sleep. And so getting, you know, uh, with EMDR, if you do 12 sessions, right, it takes the diagnosis down from PTSD to like just regular anxiety. So you can do that in 12 sessions. So they can get some sleep. They've got to be able to get sleep.
Yeah,
You have to get sleep.
I have to get sleep. That's crazy. I was learning about CBD gummies because people take those to sleep, and so I was asking a sleep expert friend because I'm pretty pro estrogen and progesterone to sleep, but I'm like,
Sure.
tell me about CBD. What's the
Yeah.
data say?
Yeah.
And the sleep expert said that CBD helps you fall asleep, so that's why people like it, but it limits memory consolidation,
That's not
probably
good then.
through REM sleep
Yeah.
effects. Right? And so I'm like, God, I knew it. I knew I didn't want to like it. Right? And you're like, dude, it's like inhibiting your ability to take short-term memory into long-term memory.
Also, there's some data to show that if people are doing any kind of marijuana product, that it affects EMDR. So EMDR is not as effective,
Interesting.
which, well, now I'm wondering if it's because of that, because the memories aren't consolidating like they do
Right?
in sleep. Yeah.
Yeah. Very, very interesting.
Mhm.
Are people open like when you talk to them and they're like, you're like, maybe perimenopause is part of this. Like, are people open to that?
Sometimes this is the thing that happens. This is where I get really frustrated is I'll say, I think you're in perimenopause. We do the checklist. And then they go see someone who's not trained. And then they come back and they're like, I started some vitamins. I'm like, vitamins is not the same as estrogen. But I'm a therapist.
But
I'm not a doctor.
but they're made from plants
I know. I'm
and
like, so's your
plants are
progesterone.
good.
Yeah, but then I'm like, okay, well, I think you need to get a little more information, right? And then I go through my whole spiel, I give them your podcast. I'm like, go listen. But then they just hear like someone who's not trained say they're not in perimenopause or that hormones are dangerous or that they don't need them because they're not menopausal yet. That's another whole thing.
Right. Yeah.
Or
You're
they're
too
doing
young.
tests.
And
Yeah,
then as soon as you don't have periods anymore, now you're too old to get on hormones. Like there's
right.
literally like 1 week in there that I think you're allowed.
I just
It's
think I wanna be
awful.
on these for the rest of my life. I just like, I'll just be on my estrogen, my progesterone and testosterone. When I'm in the coffin, they'll have my little
Totally.
estrogen patch on.
I always ask people, I'm like, because they're like, can I take, how long do you take this? And I ask them, I'm like, well, what are your plans for death? Like, are we going to be cremated? Are we going to be buried? Like, what's your plan? And most people kind of know. And so they tell me, and I'm like, okay, well, you can burn it, or you
Yeah,
can, and then I say, or you can bury it, like whatever you
right.
want, take it with you.
Yeah,
It's fine.
yeah.
You know what's very interesting about testosterone? Testosterone kind of has this stereotype of like the desire hormone, and I would argue estrogen's a great desire hormone too. But people think of desire as like I love the word appetitive, but it's like a forward pursuit of
Mm,
sex.
mm,
And I see, and this is way more subtle. Let's see if you see it. But I see in women who are on testosterone, it's not so much that they're like gonna go pursue sex, but they're just a lot more open to receiving it.
yeah.
It's like a positive receptivity that testosterone, and I think like that gets lost in the translation of like testosterone affects desire is like you think you're going to go out and ask a bunch of people on dates or something, but you're more just like, I would say yes. I would say yes a lot more today than I would have said yes a month ago. And it's like almost this, am I explaining that well? Like it's this, like, there's probably a word for it in the sex therapy world. It was like, it's like this but not, it's not a passive acceptance. It's like a hell yeah,
Mhm,
come and get this.
mhm, mhm.
Is there like a word for that in sex
Well,
therapy?
there's something similar. It's called responsive desire.
Yeah, but it's not so, yeah, but it's okay. So maybe it's just like more responsive desire.
More responsive. Yeah.
But like, yeah, but even like the idea of sex, you're like, uh huh. Maybe, yeah, okay. So it's maybe like putting some gas on the accelerator,
Yeah, yeah.
but it's not
Right.
like a pursuit.
No, I don't think so. Well, because we're still taking like 1/10 of what men take for the
Yeah, I mean, I think for
testosterone.
some people, especially if they dose it high, they'll get a pursuit.
They
But
could.
I just
Yeah.
want to explain to women, like, it's this more subtle, like, yes, I think yes to sex.
You know what? It feels a little more like the playfulness comes back, I think.
Hmm.
Like, playful flirting. I'm interested
Who doesn't love
in
that?
this. Isn't that good?
It's the best thing. It's like,
Right,
you
but
want
there's
to?
this
No?
like,
Okay. Tomorrow? Want to do it again? Okay.
with our partners, we want to have this energy. It's like this playful, flirty energy. It's this kind of back and forth, right?
Yeah, who doesn't love
And
that?
that throughout the day is like what makes good sex.
Yep. What do sex therapists and you think about scheduling sex?
Absolutely. You
Yeah.
have to. Well, I mean, and everyone's response is, I don't want to schedule sex because then it's not natural, right? It's no fun. But then this is what I say. Look, when you
Nothing's
were
natural.
dating, nothing's natural,
Monogamy
right?
is not natural.
It's not
40
natural.
years. I was reading this, sorry, like tangent.
Yeah.
Back in the day before longevity, the average, like, this is like the Victorian era or something, average marriages were 8 years long before somebody died.
There you go.
Like,
That explains the 7-year itch.
right? It's like
It's right
that was
after that,
average
you're
length
just
of a
dead.
marriage, but and then
Yeah.
somebody died,
Yeah. Yeah.
which was natural.
Well, yeah. I mean, there's just so many more ways to have relationships these days, to have good, longer lasting relationships, if that's what you wanted, if you want something else, then there's ways to have that too. But that energy is really super important, maintaining that energetic bond.
I think that's what Esther Perel shines in her teachings. She's like,
She's
"Do not let this get stale, people. That's on you if you let this get stale."
Well, and she's so good with words and so
Yeah.
direct.
Well,
Yeah.
she only speaks like 8 languages.
She's brilliant.
She's got
She
there's
is.
a lot of words in there. Um, all right, well, let's talk about that. Let's talk about consensual non-monogamy. Let's talk about open relationships because I think it's all, I don't say all the rage so much as like being talked about more.
Yeah.
Like it's always been happening, but we're
Yeah.
just a little more open about it now.
Yeah.
Mm, So like the true, I don't say the true experts I've talked to, but people are like, it's actually quite difficult to maintain that. It might sound like a very good idea. Maintaining that long term is an absolute challenge and it's not for everybody. And you have to really be an adult.
Well, what I find with consensual non-monogamy is there's a lot more transparent conversations that are happening. There's actually there's a lot of agreements that are put in place. So like in a traditional heterosexual relationship, you get married and the monogamy is just assumed, right? People aren't having really in-depth conversations about what that means. Even in a married heterosexual couple, is it cheating if I watch porn? Is it cheating if I'm watching live porn? Is it cheating if I'm watching live porn and now I'm starting to chat with that person? They're not even in the same city. Like, what's defined as cheating, we don't even know. Most couples don't even know until it happens. And then right, and then you cheated on me. Yep.
Ugh. That's what I'm talking about. I'm like, it sounds great. Like, oh, some novelty. And it's like, no, 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 no. You better be a real good communicator. You better know your bound. Like, there's some rules you have to
Absolutely.
establish, right?
Yeah.
How often do you see that? How often do you see it go well? How often do you see that go poorly? Do
I
you
don't
advise it for the average person, or are you like, you got better lay some groundwork before you open this up?
So my practice is like a vanilla practice. It's a lot of heterosexual couples, right? I don't see a lot of consensual non-monogamy.
You practiced
So
in Vegas.
I know, and no, it
Vegas
is
has a whole bunch of monogamous heterosexual couples walking around.
they're not monogamous, but they get married. They have affairs. That's what I
They have
do.
affairs.
They have affairs. That's not consensual non-monogamy,
That's correct.
right?
Okay.
Yeah,
So they
at
are
least
having
I
sex
didn't.
outside the
They are.
relationship, but without permission and without any communication, and they've
Exactly.
usually fucked it up.
Yeah,
Okay.
repeatedly.
Repeatedly fucked it up.
Mhm. Yeah.
Now how are you just like, "Let's start we just have to start today?" Like, we can't rehash that
Oh, well, like, we have to rehash it. I mean, but we're not gonna rehash it in detail. Like,
forever.
whoever has done the cheating, right, stepped outside the relationship, like, I guess it depends on where they're at and what they want in their life. If that's something that they wanna continue to do, right, then we have that conversation. But there's just so much mistrust that comes up in a relationship, and people can have PTSD from being betrayed. Like, you can have emotional
Yeah.
PTSD from that. When it happens, you can't eat, you can't sleep, you're having nightmares, you're reliving it over and over. I mean, it's the same symptoms as PTSD. And so it's really difficult. And, okay, there's a big difference between someone who's maybe just done it once, right? Like, they had too many drinks. And I don't like to say it just happened because there's a lot of choice points along the way. Right. But if they've been, really a great partner for 10 years and this happened, or 15 years, that's different than you're in the first or second year of marriage and this is happening repeatedly. That's completely different in relationship.
The sense of safety, I think, for women's sexual desire and a woman's ability to experience orgasm and her ability to actually, like, let go and relax and enjoy the
Yeah.
present moment. Like,
Yeah.
nobody talks about the amazing power of safety. And I don't think a lot of people think, like, psychological safety. They're like, "Well, we lock the door." But it's like, do you feel safe in both in your body and
Right.
with your partner? Like, there's
Yeah.
a lot of safety that's kind of assumed and then but never talked about.
Yeah. No, that's super, super important, right? So that safety piece, right? Because once again, that's regulated by your autonomic nervous system. So if a woman is not feeling emotionally safe, her survival center is going to kick in. Fight, flight, freeze, or fawn. So this is the deal. Your survival center doesn't know the difference between a physical threat or an emotional threat. It will respond the same way because it's both pain in the body. So if I'm feeling emotionally hurt by somebody, I'm gonna f I actually feel pain in my body, like, if you've ever been really hurt or you lost someone that you loved, it's like you feel the ache in your heart. It's a physical sensation. So, most of us we're just separated from the sensations in our body because we orphaned them off a long time ago. We cut it out, those things, we don't need them, right? But then that becomes a real problem because now I'm not feeling safe in my body, and maybe I don't know why I'm not feeling safe in my body. And it could be things that happened in childhood. It could be things that happen in past relationships or current relationships. But, like a huge part of EMDR or polyvagal therapy or parts and memory is getting people back in their body to notice the body sensations so that they know when they're feeling safe and when they're not feeling safe, and then what they can do about it so that it doesn't feel out of control for them.
Is that more like mindfulness-based practices, or do you have, like, a book that you like to refer people to?
Uh, you know what I mean? For like
Like,
if they're not
if people are like, "What do you mean get back in my body?"
like feeling safe inside of your
Yeah.
body, like feeling calm, grounded, connected in the moment, that's really important. And it's especially important during sex. So a lot of people spectator, so they're outside. It's like they're outside watching what's happening versus being in the present moment. And so learning how to be in your body is important. And so if people go into like fight, flight, freeze, or fawn, they're not in their body, right? And so if people have had pain in their body before, then this is all happening unconsciously, by the way, everything I'm talking about. If there's pain in their body, they're automatically pulling away. And they do it unconsciously. They don't even know. So when women in perimenopause start having like maybe the little tissue irritation, right? It feels a little uncomfortable. Their body will start to unconsciously pull away and they don't even realize it until they're just not even having sex anymore because it happens a little bit at a time. And women are so conditioned to think that it's normal for sex to feel uncomfortable, right? Okay, it's not normal for sex to feel uncomfortable. If sex is feeling uncomfortable, then let's have a conversation because there's so many things that could be happening, as you know, that they're not warmed up enough, they're not turned on enough, or maybe somebody's gone too deep, or there's something going on with the tissue, right, in heterosexual relationships. So if their body's not feeling safe, even if they are safe, but their body thinks that they're not safe, they're still going to pull away. on an unconscious level. So we have to bring the unconscious to the conscious so that they can be present and work on it
Love it.
in a safe way.
In a safe way, where do people find ASECT is the best place to find a sex therapist who is
Yeah. Asect.
trauma
Yeah.
informed, can talk about
Yeah.
sex.
Yeah. You can look at ASECT and also see if they're trained in EMDR. You want to find someone who is at least trained levels 1 and 2 in EMDR and does a lot of EMDR. Brain spotting is another good one. I don't do that. And art is another good one. I
Yep.
don't do that one. So
Okay.
there's a few really good ones out there. So if you can find someone who does both, that's really good.
Amazing. I love it. What's one common myth about women's sexual health in midlife that you want us to debunk today?
That women don't want to have sex.
If a woman comes to you and she's like, "I don't wanna have sex," are you like, "Yes, you do?"
I'm like,
Like,
let's
how do
explore
you work
that.
with that?
Let's explore that, right?
Yep.
Let's look at that. And maybe she really, really does. Some people are just done with it, and if they're done with it and their partner's done with it, not a problem. They're both done with it and they want to have like a loving roommate situation where they care for each other, they do fun things together. Okay, that's fine. But if one person wants it and one person doesn't, well, let's start to look at that. And why she doesn't want it. Because if it is pain related and she doesn't know that it's pain related because she thinks sex is supposed to be uncomfortable, or if she's had a partner who is doing sex in the traditional way, the destination sex, and she just may not want that anymore and may not even realize that's not what she's wanted because she's never been asked the question. If you could have sex, how you want to have sex, and what feels good for you, what would that look like?
I love it. I think the other, like, amazing the sexological body worker who told me this is like, what are your top 3 feelings you would wanna feel with sex?
That's a
And,
good
like,
question.
work it that way too, because
Yeah.
like, lots of people are gonna have very different answers to that.
Yeah.
I
Right.
think the
Because go ahead.
I was gonna say, and the other thing is, like, how many people have actually asked their partner what sex means to them? And it's usually different than what sex means to you, and then those 2 people are living together.
Yeah.
You just you help them communicate. But yeah, okay, so it's fair to say when a woman's like, "I don't wanna have sex. I could take it or leave it. I don't wanna have sex for the rest of my life. I'm done." Let's ask a couple of questions first before then saying, "Okay, I agree that you do actually seem done." I think a lot of women suss this out for us. A lot of women are like, "Am I asexual?"
Well, some women might be, right? But that's zero interest, right? And there's so much between 100% gas pedal fully down and zero. There's a lot of room between there. I mean, some women are really okay having really great sex once a month, really great sex once a month, but that's not asexual.
Right. And, like, sex that serves her and that it's not a chore and she's not doing it like, doing sex for another person, but not in a, like, want that turns me
Yeah,
on to do this for you. Not
no.
in that way.
But women are conditioned. Women are conditioned typically from a very young age that it's their duty to have sex when they get married, that they need to satisfy their partner,
Dude, that is
right?
right, like, never explicit in the marriage vow, but it is right under there.
Absolutely. And it is that so our culture has this idea that men are the pursuers and women are to be pursued. This is the culture, right? So women are to be the object of desire. So when you're the object of somebody else's desire, then you don't think about what your own desires are. You're
Well, and
conditioned
then
to believe
you're constantly like, "Am I pretty enough? Am I thin enough? Am I" like, you're
that's it.
constantly spectatoring to make sure you match up to society's ever-changing definition
Ever changing definition.
of desire.
And there's everywhere in society, magazines, billboards, social media, everywhere. It's always telling women what they can do better. Have better skin, have better hair, have longer eyelashes, have perkier boobs, have less wrinkles, have fuller
Cut off
lips.
your effing labia.
Oh my God, I can't with that,
I
right?
can't with that right now. I'm struggling big time with it.
And then
Ever moving societal mores.
like, are we telling men to have smooth balls? No, we're not telling them to have smooth balls. Like,
We are injecting, not we as in
excited
not
about
I.
that. Botox, right?
Well, Botox and scrums, men are getting reversible fillers in their penis. And then there is I know, I'm sorry. And there is a surgical procedure that actually puts a sheath around underneath the skin of the penis, but that makes it look bigger flaccid. Doesn't actually make it look bigger erect. So it's great for like walking around naked and stuff, but is fraught with complications. So I mean, men have the same pressures as women. But I'm like, dude, women, we don't have a place to go online to safely say, are we normal? OMG, yes would be one. Make love, not
Yeah.
porn would be one.
Yep.
So there's 2 places, but people don't know
Yeah.
about those.
They don't know about
And
those places.
and
Yeah.
so then they look at surgically altered or atrophic vulvas, and then they pay money. That's the thing, is like women don't have as much money as men in our culture. Don't make them spend it on cutting their labia minora off. And then they all come to see us in perimenopause and menopause when they've got clitoral adhesions and no labia minora, and they freak out because nobody tells them it goes away. It's like you're damned if you have labia minora, you're damned if you don't.
Well, there's a lot of sensitivity in the labia minora, and it's like when you start cutting that, you're risking losing sensation, not to mention that, they close, right? They close. So it helps to prevent
It's their
infections.
protection. Their protection.
Their protection.
Yeah.
Yes.
And I'm not talking about the people who truly have hypertrophy and it pulls in and it gets caught on the bike
Yeah.
seat. Like, I'm not
Yeah, that's
talking about
different.
that. I'm talking about cosmetic,
Cosmetic.
ever moving societal norms of what you're. And I'm like, how many people are you actually showing your labia to? Not
I
that I'm
know.
judging, but I'm just saying it's not like nice dental work where it's kind of your forward facing hello to everybody. It's not a handshake.
Right. And don't you want a partner who's gonna love you just like love your vulva? It's like, well, why wouldn't they? I mean,
I know that's the thing is like, I don't want my partner to judge me. And I'm like, if your partner's judging you, warning.
let's talk about that.
Let's talk about that. Can you write a book and call it "Let's Talk About That"?
Let's talk about
I think we've I
let's
think
talk
we've
about
I think we've named your book for you going forward.
conversation.
I know.
Yeah.
Okay, so let's say we've got a perimenopausal woman, monogamous, heterosexual relationship. She is having intercourse multiple times a week, but she comes to you and she's like, "Rachel, I don't have any desire for sex."
That's fascinating. Yeah. Well, so I do the perimenopause and menopause checklist. I do the GSM checklist, right? Let's just see physically where things are at. And almost always there's stuff that's being checked on that, right? So we have to check like what's going on with you, right? And then I refer out, right? So I'll send to a specialist, right? If there's hormonal things going on with perimenopause and menopause. If all of that is fine, right? Then it's like, well, let's start having conversations. Have you talked to your partner about this? What do you feel? And they're like, I could never tell my partner this. I could never tell my partner that. And then it's like, well, let's start to do a little deep dive. What are you worried will happen if you say this to your partner? And there's usually some fear that's underneath that, or they have some body image issues going on. And women have beautiful bodies, like, just throughout their whole lives. And yet we've been trained to believe that we have to look us really a certain way. And, you know, I think that a lot of men are actually, really wonderful partners and they love who they're with and they love their bodies. But when you have it inside of you that you're not attractive, it doesn't matter what your partner thinks or says, right? So then it
And
becomes hard.
it creates cognitive dissonance. Like,
It creates
like
cognitive
the more
dissonance.
you're told that like Republicans are right, the more you double down on being a
Yeah.
Democrat. Is like the more you're like, but you're
Yeah.
beautiful, but you're beautiful. You're like, I'm
Yeah.
fucking not.
Yeah.
Right? Like
And what's wrong with you that you think that?
right, exactly. Like it makes that cognitive dissonance worse sometimes.
Yeah. Yeah. Agreed. Yeah, so then we start to look at that and, we just start to explore what's going on with them. And there's little exercises, that people can do. You've probably done this, but I'll tell people like, well, let's see what happens. Have you ever listened to anything really spicy? There's all these, I mean, you can read a Court of Thorn and Roses, right? That's a spicy fantasy book if you don't want to go full on erotica. I don't know. A couple of the passages though.
Kelly's rapidly downloading. It's available in audio.
It is. God, Kelly. I read the first book and then I listened to the second book and I was at home in my kitchen and I like cleaning the cat. I had to stop for a minute. I like, can anyone hear what I'm listening to right now?
Like, yeah, does anybody know how hot I am right now?
Yeah, right.
I
So,
mean, this is like people will be like, my doctor just told me to listen to my porn. My doctor just told me to read erotica. And it's like, there's a sliver of truth in that statement of like the brain, you're putting yourself in a sexual context. The brain's
yes,
responding. It can feel
right.
quite pleasurable to
Yeah.
see how turned on that feels. But I'm always like, doctor's appointment is 10 minutes. If the doctor leads with like, just watch some porn, it's tone deaf. but there is truth in the recommendation. It just has to be given kindly.
Well, and I'll give them options, like depending where they are, right? Some people are okay with porn, some people are not okay with porn. So I'm like, well, let's just start with something spicy. We'll just have a little spice. Okay. If you want something,
What's the difference between spice and porn in your book?
well, like a quart of thorn and roses, that's really could be crossing the line.
Wait, hold
But
on.
there's like
What's this called?
a quart of
A
thorn and
quart.
roses.
Like a queen's quart? Or like
Yes,
a
it's
quart, like a 2 pints?
so like a queen's court.
Thank you.
COURT. So there's like a whole series. It's called ACOTAR for short. People call it ACOTAR. It's
Okay.
a it's fantasy.
Rachel better be texting me this when this podcast ends.
I'll text it to you.
I mean, I need to do some research.
I
For
didn't
the
know.
podcast.
Just like sci-fi and fantasy. I didn't know the first time I read it. And then then I read the whole series. Well, actually, then I listened to the rest of the series, which was a lot of fun. So spicy, right? With an actual plot. It has an actual plot.
Got it. I love it.
Versus just full on erotica.
In your face. Got it.
Doesn't really, you're not listening to it for the plot or
There will not
reading
be
it.
a test.
No, there's no test. You don't
There's
have
no
to remember
test.
the characters' names. This you
Dude,
can
and then
remember
there's erotica, like to go completely off script right now, but there's erotica of like characters we know, right? There's like Star Wars erotica and there's like Harry
Yeah.
Potter. It's like it's like fan fiction.
Yeah, fan fiction.
I'm like air quoting. It's like fan fiction, but erotica that people
Yeah.
write. And these are like huge genres.
Yes, huge.
Huge genres. You gotta find a erotica fan fiction author to come on the podcast.
That would be great. Maybe you can get, what is her name? The Court of Thorn and Roses. She would be great.
I
Have her
love
on your
that.
podcast.
Okay, so yeah, it does things to the brain that can help the accelerator and for you to be
Yes.
like, that's what being turned on feels like. I'll try to bring that into the bedroom or get that going. Like it can be very
Sure.
useful.
It can be very useful.
Okay, so if you're having intercourse multiple times a week, but you say you don't have any desire for sex, I think two things. I think either you're not letting enough time go, but maybe you're having great sex. You're not letting enough time go between to actually let the natural desire come back. You're just kind of like just scheduling sex frequently and not letting like, hey, it's been a while and you're looking kind of good, right? So maybe you've just dampened down the refractory period for when
Sure.
desire could come up,
Yeah.
or you're having sex for somebody else. It's actually not enjoyable sex and you don't have desire for it because it's a chore. Like I floss 3 times a week.
Right. Yeah. And it doesn't
Okay.
feel good when you have to do something. No one wants to do something that they have to do.
Nobody does. Dude, my 7-year-olds don't want to. The 45-year-olds don't want to.
No, because
By the time you're 90-year-olds really don't want to do what they don't want to do.
no.
Right?
And
like
then
there's no age where you're exempt.
No. And then you're like, can we just get it over with? Well, that doesn't feel good for either person. I mean, do you want to be having sex with someone who's like, let's just get it over with? That doesn't feel good.
Ugh.
I know. I don't say that. But it's like, when you think about it, it's like, I don't want to do this. It's not good for you and it's not good for them.
Yeah. I mean, I think at the end of the day, and again, we're heavily heterosexual in this conversation, but most men do care.
They
Most
do.
men want to give pleasure. Giving pleasure is pleasurable. And nobody ever talks about that.
It was very pleasurable. That's a whole visual piece, right? And an auditory piece of seeing the person that you love receiving pleasure. And I would say that most men do want to do that.
Yeah. And they want to know, they like to know they're good at, the men like being good at things.
They do, right? So, and a lot of men are really receptive. They change this up, change that up. But it's not like what you're doing is horrible. It's like, oh, well, you know what I might really feel good is, hey, let's try this.
Right. Yeah, let's try it. And that's what's so interesting. Because they're always like, change it up. And they think they have to like buy a swing and have 12 different vibrators. It's like, no. Like, pressure, touch, frequency. Yeah, at this angle instead of that angle. Like, it's subtle things. I was, the flow state, when you research the flow state of like when you get into a flow state, the novelty part, it can't be more than 2 or 3% novel.
Yeah.
Because otherwise it's too new and you lose your focus in your flow.
Yeah.
And that's like super interesting when you bring that into sex to be like, spice it up. It's like, yeah, but by 2 to 3%.
Yeah. It doesn't take a lot.
Doesn't take a lot.
And like, so, but what happens is that like a lot of couples can't have the conversation of how to do that because neither person knows how to have a vulnerable conversation about sex. Because it is vulnerable when you request something of your partner. You don't know what they're going to say, even if it's just a little something new. And so, like in couples therapy, I'll assign people like, okay, well, you're going to massage each other's feet or, whichever one you like. And then you're going to practice that. What feels good? How's the pressure? Do you want it to be tickled a little to the left, a little to the right? And you're doing it with your hands or foot massage, right? So no genital touching, none, zero. We're just going to practice asking for what we want in a kind way, in a hearable way, and giving that communication to our partners.
I love that. That's great homework.
Yeah, you got to start with something really small sometimes, really, really small, because sex is so vulnerable for so many people to talk about because none of us have really, really learned. We didn't learn. That's why you wrote your book. You did your TED talk. It's the sex education that should have had but never did.
I agree. I'm like, sex is really best in the hands of adults. And what I mean by that is like, we can take feedback. We can ask for
Yes.
what we want. We can be good
Yes.
listeners. We
Yes.
can not take things personally. We can
Yes.
decide not to assume,
Right.
right? It's like, that's all the adultness that like good sex actually does best with.
Absolutely. But adult selves. So we're not in our adult selves all the time. No, well, no human is in their adult self all the time, right? Because then we'd be perfect and nobody's perfect. But
We
so we have
appreciate the reminder.
So we have all these other parts to us. We have, like toddler parts and preteen parts and teenage parts that pop up whenever we get activated, right? I really like his name is Terry Real. So he and his wife Belinda, they do relational life therapy. And so he talks about the adaptive child. So the adaptive child is the part of us that comes out when we're not in our adult self. And that's the part of us that gets defensive, that wants to blame, that wants to argue, that wants to explain. And most of us, we do not know our adaptive child because it's so familiar. It just feels like it's part of us. So we don't know when we click into it. And it's just like, oh God, there she is again. So,
Truth.
well, at least that's how I am with myself.
Yeah. But with practice, you can be like, she's here right now, or there she was an hour ago.
Well,
Like
that's the goal.
with practice, you
Yes.
can start to see it and be like, okay, well, I'm gonna try to not just I'm gonna try to just listen right now.
Or to just be like, I'm in my adaptive child, right? I can feel like I just want to yell at you right now. I feel it like really, really strong, but I'm not going to do that, right? So I'm going to take a different choice. And when you take a different choice than what your body's been programmed to do, it feels wildly uncomfortable.
It's like a glitch.
It is like every cell in your body is screaming to not make this new choice.
Yeah. It's just
Yeah.
it's just so easy to do what you've done for 30 years.
Of course it's easy.
So
But then
it's like it burns way less calories.
but you got to do something different. You got to
Do something
change things
different.
up. That's the only way is or you'll just keep getting what you've gotten for 30 years.
Thank you for helping adults be adults, even though we can't be adults all the time because we're not
Right.
perfect people. I have one final question, right? Yeah, 32% of the time we can be adults. It's a goal. Okay, so you practice both in Nevada and Washington State.
So I have clients virtually in Nevada, right?
Okay. Is it
I'm in
Nevada
person.
and I say Nevada?
So the natives say Nevada.
Nevada. Golly, I'm like an
Yeah.
American. I should
Well,
know
I
these
had to
things.
learn that when I moved there. Someone was like, Rachel, you can't say Nevada anymore because I grew up in Texas. It's just Nevada.
Okay,
Yeah.
Nevada, sweet.
There
Okay,
you go.
so you see people in Nevada and you see people in Washington State, virtually in Nevada. And my question is, are they stereotypically different people with different relationships and different problems? And
They're different.
if you were like, this is our Pacific Northwest main sex issue, and this is our
Yeah.
Nevada main sex issue,
Yeah.
are they two different issues? Like
Yeah.
culturally?
Yeah. So when I was
Interesting.
I'm not taking any new clients from Nevada anymore because I'm just taking in person now because I'm pretty much getting close to full. So I'm not taking. But anyway, so I was in person in Las Vegas, and the relationships are different there. I would say the relationships are more volatile. There tends to be a bigger gender, so the men are very money and power oriented. And the women are very much more like beauty oriented, like how like
Like
pursuer.
feminist ideal, male ideal, like the more
Yeah.
stereotypical.
Right, and there's
Okay.
just there's a lot of money in Las Vegas, right? And there's a lot of problems. So I find the therapy here in Bellingham to be refreshing. So I dealt with a lot of narcissism in Las Vegas. Okay, so narcissism has to be diagnosed. It's a very specific criteria. So I dealt with a lot of narcissistic traits, but narcissistic traits are still non-relational, right? It's really hard to be in a loving, kind, connecting, equitable relationship with someone who has narcissistic traits and who's not willing to work on them. There's a lot of that in Las Vegas, and, a lot of the women I worked with didn't realize that they were being gaslit, that they were being lied to, cheated on, and they didn't realize that someone who has lots of narcissistic traits, it's actually in an emotionally abusive relationship to be in a relationship with somebody like that, and it just kinda whittles women down, their self-esteem just shrinks down, and it's like, kinda like it's like just a slow form of brainwashing, and then they're caught. Yeah.
Oh god.
I know. Not I don't really
So
see that
hard.
here. Very rare do I see that here. Here, I have a lot of not
We
that
have
all the
cute
couples are bad.
problems. Oh, let's just say vulva, everybody.
Maybe there's
Let's
some
just find the clitoris today.
I find that so the men here, they know the terms emotional labor and mental labor, right? They're very open to being equitable partners. People get a little sad in the wintertime. I have
Yeah.
some of that, seasonal affective disorder. That's nothing compared to narcissistic traits.
Yeah. Well, we're so glad I mean, we still have problems, so we're glad that you're here.
Yeah, yeah, but I find it very refreshing. I love it here. I know I keep saying that.
No, this
I've
is
been here a year and I love it.
it's the best place ever. And the sun's out now, so
Yeah,
we're soaking it in.
yeah.
Oh my gosh. Thank you so much for coming on the podcast.
Oh, well, thanks for inviting me. This was a lot of fun.
It was so fun. Yeah. So many fun tangents. We'll figure out the erotica and I'll do a personal research inventory on how it's different than porn.
Yeah,
And I'll write a
yeah.
blog on it. Everybody can find you at rachelboyle.com. But by the time this comes out, she might be full. I mean, that's the big thing. When I moved to Bellingham, there were 0 sex therapists. Now there's probably 6-ish. I'm just off the top of my
Okay.
head.
Yeah.
But like, it's still really hard to get in and see people because they're like all full.
Yeah. Yeah, and I would say for someone who's in perimenopause or menopause or thinks they might be, you wanna find a therapist who is aware of that and is screening for that so that you're getting proper treatment, because if you are having anxiety symptoms or depression symptoms or low libido or all the things, and it is related to perimenopause, you don't wanna have that dismissed.
No shit.
Right.
God. I'm like, you can't have like you can't do all the other stuff if the hormones are off. I was telling somebody the other day, I'm like, the hormones are the that you have a solid foundation, a nice basement. Like
Yeah.
they're not everything, but they're a nice floor.
No, they really are, and therapy goes so much faster if someone
Has
uh,
neurotransmitters? Shocking.
yes, and they're getting proper sleep, and they're able to exercise because they feel good,
And their clitoris has blood flow.
and their fish has blood flow. That's a huge difference.
It makes a huge difference. All right, my friend, until next time, thank you so much for coming on the You're Not
Yep.
Broken podcast.
Thanks for inviting me.
Cheers.
Bye.